does show about 500,000 nurses are planning to leave the profession within the next 4 years.
Why? I honestly feel like a broken record on this. I don't know how many times I got to say it. Our nurses and medical staff are so underpaid and not taken care of at all by the suits. At what point do we have to start looking at health administrators, CEOs, board of advisors, all of this compensation that the suits are making in the hospital, but yet none of their hands are the ones that actually make a difference in the lives of people? They just simply make decisions, punch a calculator, and see how much profits or revenues that the hospital can generate, whether it's for-profit or non-profit. And for the majority of these executives and in these executive roles, they make anywhere between $700,000 up to $20 million plus annual. And yet a nurse typically gets a 25-cent annual raise for all that they do. And what really kills me, being married to one of the most amazing nurses in the world, the amount of stress and lack of flexibility in some of their schedules for some of these medical staff and nurses. For example, the 3-day 12-on shift, if your circadian rhythm doesn't catch on, or you get double days in that schedule, whatever that looks like, all of the pressure, no matter what you do as a nurse, as a medical provider, your butt is on the line. Because if you make one mistake, if you don't chart something absolutely perfect, in today's litigious society, they could lose their jobs, they could be sued, all of this bad stuff falls on them. And yet they are working these outrageously long, hard hours. What do you think outcome is going to come of that if the hospitals keep grinding them down? Look, in closing, y'all know how I feel about this. I love nurses. I love our medical. I love our doctors. I love them all. I think they all kick ass. And I think America has some of the best in the world. But holy moly, we have got to do a better job of taking care of these people. There's no reason we're paying $20 million to executives when we can't even give these people the proper pay in the right family balance schedule so they are at their peak abilities to perform what they do best, and that's practice medicine and take care of us as patients. That's all I got to say. Let me know in the comments what you guys think about this. 46% of nurses are leaving the industry. Unreal.